Did you know that 1 in 5 Americans experience mental illness in a given year? Gaining access to treatment is essential, but that can be more difficult for those who live in underserved communities featuring mostly minority populations. Today we'll hear from members of an innovative community partnership on what they're doing to close the health equity gap in providing mental and behavioral health services. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, Senior Writer with AHA. July is National Minority Mental Health Awareness Month. In this conversation, Lisa Hinton, Senior Health Equity and Value Specialist with the AHA's Institute for Diversity and Health Equity, speaks with a faith-based organization leader and 2 healthcare experts on ways they are broadening their health system's approaches to improving community access to mental and behavioral health services in the Greater Bronzeville neighborhood on Chicago's South Side.
Thanks, Tom, and welcome everyone. Today I'm being joined by Pastor Chris Harris of Chicago's Bright Star Church, who also runs the Urban Resilience Network. I'm also being joined by Brenda Battle, VP, Urban Health Initiative, Chief Diversity, Inclusion, and Equity Officer at the University of Chicago Medicine, and Dr. Clyde Yancey, Chief Division of Cardiology at Northwestern Memorial Hospital, Vice Dean, Diversity and Inclusion at Northwestern University of Feinberg School of Medicine. Thanks very much for taking the time for this important conversation. The goal of the National Minority Mental Health Awareness Month is to raise awareness of disparities that continually impact minority populations and to promote tools and resources that promote health equity. Health equity is the attainment of the highest level of care for everyone. My first question is for both Brenda and Dr. Yancey. What are your roles in your organizations, and how do they pertain to improving mental health services in your communities? Brenda, let's start with you.
Great. Thanks a lot, Lisa. I appreciate the opportunity to talk to you and to respond to that question. My role at University of Chicago Medicine is Vice President of the Urban Health Initiative and Chief Diversity, Inclusion, and Equity Officer. And in that role, particularly the Urban Health Initiative, our responsibility is to really work alongside the community to identify the complex issues that our community is dealing with day to day and work with them to address those issues. Mental health is obviously one of those issues. So a lot of our work is in the space of not only looking at community-based issues, but also how are those issues addressed or intervened for. And so mental health is an area that we have to spend quite a bit of time in because there is such a dearth of those services on the south side of Chicago. It's one of those poor access areas for persons on the south side, understanding that a number of those individuals that we work with day to day are impacted by mental health or behavioral health issues, whether it stems from being in a community that has a high rate of violence or just years of not having access to these sort of services or not really recognizing the value of utilizing those services.
Thank you for your efforts, Brenda. And Dr. Yancey, the same question for you. What is your role in your organization, and how does it pertain to improving mental health services in your community?
Well, Lisa, thank you very much, and particularly thanks to the American Hospital Association for recognizing National Minority Mental Health Awareness Month and inviting us to be a participant. My roles are diverse. I am the Chief of Cardiology at Northwestern Medicine, which means I oversee a group of nearly 100 cardiologists. We've been deeply involved in the response to COVID-19. Within the medical school, Northwestern University Feinberg School of Medicine, I serve as a vice dean. Particular space is diversity and inclusion. And then in addition to that, I continue to be an active practitioner and an active investigator. So I bring a number of lenses to this issue. Uniquely within Northwestern Medicine, I'm very closely aligned with our Department of Community Affairs and work very carefully and diligently with Posh Charles, who leads that effort, to really help deploy a number of the very important community efforts. So you might pause, Lisa, and say, why is a cardiologist participating in a discussion about mental health. We have learned a great deal of information from the COVID-19 crisis, and we understand that especially here in Chicago, where the Black population has been so severely affected by COVID-19, it has been uniquely noted in key neighborhoods which have extensive social vulnerability, meaning that it is much the place where people live as it is the race of the people who've been impacted. That has focused our attention on this concept of the social determinants of health, and we very quickly have learned that part of the constellation of these social determinants of health is, in fact, mental health and wellness.
Thank you, Dr. Yancey. And Pastor Harris, can you share with me about Bright Star Church Urban Resilience Network?
Our mission is to empower residents to share in the responsibility of building community through resource development and collaborative partnerships. And we accomplish that mission by developing innovative performance-based practices and programs to address the need for violence prevention, community engagement, economic development, education, and healthy children and youth and families. Now, our vision is we envision today's underserved communities to become self-sufficient, livable communities for individuals, families, and organizations, communities that are strong and nurturing in positive thought and behavior in the home, the community, as well as the marketplace. And we do that through 5 core competencies: counseling, mentorship, parenting, workforce development, and advocacy. And everything changed for us about 8 years ago when I went to Israel and saw a place called Natal. And while we were already offering after-school programming and some levels of safe passage, when I went to Israel and saw the place that focuses on PTSD for those in Israel, I said, wait a minute, we need this model back in Chicago. And so, yes, trauma is a big issue over there, but I said, boy, you can imagine the fact that we are literally burying people every day and counting body bags and toe tags every day in Chicago. So I said, what I saw there, trauma counseling, I wanted to bring it back to Chicago. And our friends from Northwestern partnered with us and jumped in. Our friends from University of Chicago jumped in with us, the United Way. And now we have Cigna and so many others. And now this trauma helpline that we have all developed together is serving currently up to 600 people that are constantly calling the helpline, as well as our ambassadors have been able to touch more than 42,000 people in Chicago in the last 3 years alone. We opened up our helpline 3 years ago on July the 3rd, and we are amazed the amount of people we have touched and the amount of help and hope and healing that we've been able to bring in. And that's what's really been exciting.
Wow, this definitely sounds like a dynamic partnership that you all have together. And definitely there is a need with the number of people that you have outreach to and been able to provide services, and a really nice program. Dr. Yancey and Brenda, what were the factors that caused you to seek a partnership with Bright Star Church? I will begin with Dr. Yancey.
We cannot thrive if we are not addressing the needs of the entire community. And the only way to do that is to reach out to the community and find those champions, those leaders that will make a big difference. And so we are totally aligned with the vision. We are totally supportive of the work, and we have put our resources, our leadership skills, even our financial support in sync with the incredible efforts that are represented, particularly by Turn. We think that that is a model that can be replicated. If you consider that it was birthed out of this eureka moment that Pastor Harris had on the trip to Israel and realizing the kind of violence that's happening in our community, well, guess what? That violence now is happening from a social construct, and it's happening because of COVID-19. It's happening because we are dying at a disproportionate level. The lessons that Pastor Harris has learned from Turn undoubtedly can be applied to the social crisis that we're feeling, that we're experiencing at the same time. So there are innumerable reasons why we're aligned, but let me just say one last thing. It's the right thing to do, and it's the right person and the right entity with which to be aligned.
Great. And you, Brenda?
So when I came to Chicago 8 years ago, and when I began to reach out in the community to persons to connect with, knowing that after coming from a background of community engagement and public health for a long time, I knew that I had to connect with the persons in Chicago that were boots to the ground, working on initiatives that could solve real problems in our community. And I stumbled upon Pastor Harris as one of my very first meetings as I was moving around on Listen and Learn. And when I met with him the first time, he mentioned this concept of using a kind of a multifactorial approach to addressing the issues of violence in the community, using a model that was effective in another part of the world, bringing that model here, and then relying on community ambassadors to be the connector between the community and the services that he envisioned. I've spent a lot of my time working in communities, came from an activist family, and knew that the only way to be effective in addressing issues in the community is to work alongside the community and let the community guide that. And without a doubt, the Turn model has done exactly that. And so we stand behind the work that he's doing. We are partners and will be partners for him. He's solving a big issue in our community, and he's bringing the coalition of the community around solving it. And we are a member of the coalition along with him. And so it was not even a question as to whether or not we were going to support it. And we're seeing the benefits of what he's doing and what we're doing together as partners.
Well, thank you for that response, Brenda. And you've kind of already begun to allow a segue for me to ask Pastor Harris this next question. We know that community health workers have been found to be effective in improving access to care. Can you please share with me the role that they play in the implementation of your program?
When you think about community health workers, they are effective in improving it. But I think one of the things that has been really exciting about the folks that are in our community is the knowledge transfer, sitting at the table to understand one another, helping the folks in the community to understand if we ignore health, if we ignore the science, if we ignore the research, then guess what? It doesn't help us. It certainly doesn't serve us well. And I would like to believe that with all that we have learned at these various tables, and, Brenda and Doc will tell you, it's been some uncomfortable conversations. It's not been very, very helpful at all, but we all have one goal in mind. And I always say the main thing is to keep the main thing. And that is, how do we help our community? How do we use the community needs assessments that both institutions have to come up with a real plan and a real vision? It is John Maxwell that said it best. I believe that vision is foresight with insight based on hindsight, and being able to use community health workers to look at the problem, come up with a solution, and make sure that we have trust and relationship in the community to make sure that those who have questions or those who question academia, research, or medicine know that there is trust there, and we all feel the same way, want the same thing. It has helped us to really move the needle on the community, welcoming in institutions like University of Chicago and Northwestern.
Thank you. For all three of you, what does this partnership mean to you, and how does it enable you to do things that you weren't able to accomplish separately? Brenda, let's start with you.
So as academic medical centers in our communities, we're often anchors in the communities that we are, anchors for jobs, anchors for programs. We have access to philanthropy, we do research, but what we often don't have is the boots to the ground approach or the boots to the ground leverage. And what Turn has done, and Pastor Harris, is given us access to boots to the ground knowledge and given us a pathway to engage with the community at the level where we're participating as partners with the community. It is not our work to drive solutions down to the community. It is our responsibility to understand what the community needs us to do. And Turn has allowed us to understand that. As Pastor Harris said, we had some hard conversations. We had to learn to work in the community to address the complex issue, in this case, of violence and trauma, a very different way than we would do normally as an academic medical center, where we're researchers. We ask questions and we take measures to answer those questions through research. The community itself, they're researchers, and they have things to tell us that will help enable us to work more effectively with them and to have our work driven by what the community actually needs. And that's what Turn brought to us. Pastor Harris is a trusted broker in the community. Working with him enabled us access through him as a trusted broker to bring what we have to leverage our assets with community assets to help the community. Also, if you're going to implement a vision like Turn, you can't do that at the academic level. You've got to do that at the community level. And so it allowed us to be partners with that model and be participants in it and really fulfill a mission that we state as anchors in our community. So we're grateful to Pastor Harris for actually inviting us in to be a part of this amazing work and to have impact within our community.
Thank you. And Dr. Yancey, what does this partnership mean to you, and how does it enable you to do things that you weren't able to accomplish separately?
We really have been empowered by a relationship with Pastor Harris. We don't look at things as can't be executed, too difficult to do, impossible to consider. We realize that he's in the business of making the impossible probable, and that is space that we want to occupy. But most importantly, I believe fervently in the notion that you always want to leave a place better than you found it. I'm not going anywhere, but I know what I found when I got here, and I know that by working with Pastor Harris, we are creating a space that's much better than what we found before, and we're enabling the community. Look, the only reason you do medicine ultimately is because you want to help people. We weren't helping enough people, and we weren't helping all the people, and through Pastor Harris, we're doing a much better job of that.
Okay, thank you, Dr. Yancey. And Pastor Harris, you may have begun to already hint at this question. What does this partnership mean to you, and how does it enable you to do things that you weren't able to accomplish separately?
Well, let me just say this. The best example that I can give to you is bowling. I love to bowl. I had the ball in my hand, and I was ready to hit a strike. But if I didn't have Northwestern on the right side of the gutter and University of Chicago on the left side of the gutter to keep those railings there to make sure that the ball didn't go into the gutter, then we would have been messed up. And so I'm grateful that they were there to walk with us, to do the work with us, to create and to think with us. And then said, we believe in this vision enough to not only write a check, but to also personally get involved. Because can I tell you something? I find these folks in the community more now than I've ever seen any hospital in the community, right? So we're now all a family. And that's what's really exciting for me. And we could not have done that without all of the infrastructure, financial and human capital that these institutions brought to this vision.
Nice analogy with the bowling, and I really applaud the work that you all are doing together. What does the future hold for Bright Star Church Chicago's trauma program and this partnership moving forward? Let's begin with Pastor Harris.
As we've shared, the 5 core competencies certainly are counseling, mentorship, parenting, workforce development, and advocacy. And we built this model so that it could be scalable and replicable, right? We want to put it in other areas from day one.
Okay, Pastor Harris, I want to make sure that our listeners are clear on the services that are provided to someone who may call into the trauma hotline. So if someone was to call in, can you tell me about the services that are given to that person that calls into the hotline at that time?
Sure, absolutely. And I think what I would absolutely do is do a disservice to your listeners if I didn't tell them what that number is. They can call Counseling Helpline at 833-TURN-123. Again, 833-TURN-123. We were open every Monday, Wednesday, and Friday from 9 o'clock to 6 p.m., but because of COVID and as a result of George Floyd and as a result of the fact that our helpline at times spiked upwards of 43% On average, it's 19% experiencing a spike. People can call the helpline if they're dealing with violence, anger problems, depression, separation, self-harm, grief, terminal illness, vicarious trauma, abuse, fear of COVID-19. All of these things are reasons that people can call the helpline. And the reality is when they call, the first thing that they're going to get is a non-judgmental support system that is sitting there waiting to say, before we can help or heal, we want to hear. Someone that would just listen. I think a lot of times when we see that there is an issue, the first thing we try to do is fix it, change it, and things like that. But we believe in using the MOP, what we call the MOP, M-O-P, the Ministry of Presence. Sometimes people just need you to be there, not to say anything, but just to listen. And that's what's really exciting. So it's a non-judgmental environment. It is a place that is welcoming. And then they also will get emotional support. And that's really what it's all about by professionals. You have paraprofessionals that are led and oversaw by mental health professionals. That's what's really exciting. And then the fact that the Turn Helpline is in the midst of the ecosystem of Bright Star Community Outreach. There are all kinds of other things, wraparound services, after-school programming.
Okay, well, amen.
And wait a minute. And here's one other good thing. All of this work is backed by research. We have been able to get some data and get the community involved because we shouldn't do things for the community. We certainly shouldn't do things in the community without doing it with the community. And so students were able to give us data through surveys and research, and that's what's guiding this work. And it's really exciting because everybody involved feels like a stakeholder.
So what does the future hold for Bright Star Church in this partnership for you, Dr. Yancey?
I'm going to be very explicit with my response and say Bright Star has to be successful. From what I see in the walls of the hospital, in the emergency department, in my outpatient clinic, as I review the medical literature, as I contribute to the medical literature, what I see is the necessity for community partners to be especially effective. Now is our time to step up, engage, and be effective. I think that this community partnership is precisely the model that we need to replicate over and over and over again. We cannot afford to fail. I want to be very clear. We cannot afford to fail. There are too many lives at stake. There's too much infrastructure in already at-risk communities that's fraying at the seams that really needs the help of engaged community partners, and we plan to support Bright Star in every dimension we can to really enable our communities and to save the people who live in those communities. So I'm being very explicit. This must work.
Thank you, Dr. Yancey. And you, Brenda?
We're in all the way. We started with Bright Star. The model that has been put together through the Turn model is a successful model. It wasn't started from scratch completely. It was started off of an evidence-based model, or aspects of it are off of an evidence-based model. And we put that model to work in the Chicago style. We took a model and vetted it in our way and have what we think is a successful model. When you think at what the community views as a solution for them and how they respond to an evaluation question about what works, this is the kind of help that they need. I've heard over and over community members, when asked about the effectiveness of a program, respond by telling stories about how that initiative helped their life, or how that program or solution helped their life, or helped them to survive, or help them to be resilient. And that's what Bright Star does.
Okay, and Brenda, what information or lessons learned would you share with other member hospitals on how to effectively collaborate to increase access to behavioral health services?
Find out what the community needs first and leverage what you as a community hospital or an academic medical center are able to bring to the table to enable that. Listen to the community. The community knows how they need behavioral health services delivered to them, and it's not always the traditional models that we're used to. The Bright Star Turn Center brings the ambassador program to the community. the trusted community members that Pastor Harris talked about earlier that are supervised by persons with a clinical background, but these are individuals that the community trusts also, people who live in their neighborhood, pastors who oversee churches in their neighborhood. These are the persons that the community can lean to help them navigate through behavioral health issues. And so we have to be thoughtful, hospitals have to be thoughtful to utilize the assets in the community that help stem behavioral health success.
And you, Pastor Harris, what information or lessons learned would you share with other community-based organizations on how to partner effectively with hospitals?
First of all, I would start by saying be open and willing to learn from one another. Remember that relationship moves at the speed of trust. Have integrity and use the resources for what you said you were going to use it for. And then be sure to leverage the experience and expertise of the larger partners. You know, at the end of the day, we have had the privilege to have training wheels as we learn how to ride this bike. But here's what's most important for me, and I would share this. The relationship is everything, but we were willing to change and look at what we have now.
Well, thank you all for this very enlightening discussion on ways to better serve minority communities when it comes to closing the health equity gap and accessing mental and behavioral health services. July may be National Minority Mental Health Awareness Month, but encouraging all those in diverse communities to seek treatment options if they feel they need help. It is a critical effort that needs attention all year long. Thanks for listening. For more information from the Institute for Diversity and Health Equity, please visit our website at ifdhe.aha.org.